I take 1 minute and introduce you? Great. So, Dr. Saxena, medical graduate and radiologist from Osmania Medical College, Hyderabad, working in the field of environmental medicine. He is a proud member of SOPMED US Art Practitioner, Dr. Greenheart Academy's talks, INSLAR, IMA, IRIA, Ozone Forum of India, WAFT, Faculty International Board of Clinical Mental Toxicologists, IBCMT, and ISSMTCT Global Coalition for Autism, Autism Research Institute US, advisor to the Akhil Autism Group, advisor LeadCon 2017 India. Over 20 years, Dr. Saxena has helped people with chronic health conditions using latest advances in complementary and integrative medicine, which emphasizes science-based natural therapies in place of surgery and prescription medications. With vast experience in the field of radiology, he's done extensive work in autism and vaccine safety. He adopted chronic disease management programs using novel treatment procedures like detoxification, metabolic weight loss, non-toxic cancer therapies, external counterpulsation, ozone, hyperbaric therapy for addressing various ailments. The essence of his practice is balancing the physiology and biochemistry at the cellular level by removing toxicity and correcting oxygen levels. He sings very, very well. Listen to his lecture now, and in the evening, I think I can make this request. We will want to listen to a song from him.
Thanks a lot for giving such a great introduction. And I think I'll try to make a mahol about that. All the patients, there cannot be any conference without talking about what happened in the last 2 years. We all were having that COVID, so let's talk about that. Before that, one of my patients, he always tells me to sing that song. I'll just give a song. जब कोई बात बिगड़ जाए, जब कोई मुश्किल पड़ जाए, तुम मेरा साथ मेरा होगा. Come on. So I just wanted to have a kind of thing. I have selected this particular stuff. It will be 3 parts. I'll just give you overview. There are 2 of my patients who got. I'll be presenting that cases here. So there is nothing new I'm going to talk. This is all everyone knows about that. WhatsApp University has created enough furor. We all were dealing with sir. I remember taking was it your Zoom call also. So what I am trying to put across is now that all things are over, what is this things which are happening? How we can because I am sure each and every doctor is going to face this. We listen to autoimmune diseases, everyone was talking about that. Now there will be a kind of resurgence, what we are thinking about that. And sure, in the coming years, all of you are going to be very busy. Things are always changed. Har gadi badal rahi hai root zindagi. So what I can tell you is, my professor used to tell, if you know everything about tuberculosis, you are fine. Then there is a change actually. Then they started telling, if you know diabetes, you can always pass MBBS. Now I believe there are some other things which are coming up. This can be COVID or some EMFs and all that later. So why this COVID vaccine is troubling all of us? We started working on something called WHO, and we felt that there is a subset of population who are getting problems with this. Simple thing, yeah. It is like a penicillin. Some people never used to get any reaction. Some people used to get reactions. So at least 5% of the people used to get reaction. There was something called penicillin prophylaxis. They used to test the penicillin dose. In this scenario, there is all in one. Everything is being done. So you need to be very careful, particularly about the subset of your patients who are having some autoimmune issues, cancer and all that, because we are seeing a different kind of thing. My practice is purely of all tough cases we come to us. They just come to us and we are trying to see that how best we can do it. I don't want to get into details. This was one of my talks in World Forum, and I just wanted to highlight 2 cases here that will you should start thinking what we can do with this particular stuff. And okay, we are talking about RNA life cycle. This is how things move and all that. This is for the, but I can always tell you, this mRNA vaccine contains the genetic thing to make the spike protein. You are all those who are vaccinated are getting into something like a spike protein factories. It doesn't goes only here, it goes into your spleen, it goes into your bone marrow, it goes into other parts. So thing is, you have to be careful, use all the things, whatever available things are available here, and see that your patient gets out of that problem. And how things. I used to talk about autism a lot. The last 20 years I've been talking about vaccine problems and all that. But to this magnitude, we have never seen this kind of things. There were vaccines before which used to cause some problems, but this is really on this one. So we are here talking about how this mRNA vaccination is causing a big sea change in this particular stuff. This is basically your growth and auto antibodies, which are one of the things here. I would like to emphasize on a term called ADE. ADE is antibody dependent enhancement. This was picked up in 2000, sometime back, 2002 or 2003, because of the SARS-CoV vaccine. And before that, there was a respiratory syncytial virus which was there. It was done in 1960. So what they did was they have done with the mice studies, and RSV was done for the kids. It was not tested with the animal studies, and it was directly tested on you. 30 kids were given RSV vaccine, out of them 3 died. And immediately after 3 deaths, the whole thing was taken up. They said, no, this is not a safe kind of thing. So, but unfortunately, this ADE is coming recently. All these vaccines are known to cause antibody-dependent enhancement. You need to be careful about this particular thing. And we are always talking about how we can improve our innate immunity. And I'm talking about frontiers of immunology. There are a lot of references are there. We need to work. We need to understand, as a caregiver, as a doctor, people come to you as a last resort now. They try to go to Google, they try to find out small things and all that. So this is a problem. COVID-19 vaccine doesn't engage the T cells. It engages only the B cells. You have got, I think the time is not permitting me, but there is always some kind of, you have to understand what is acquired immunity, what is innate immunity, what is the T cell and what is the B cell. So many things are details, you can always go through it. I'm here to just give a food for thought to you people. This is what we urged. We thought, okay, why are we subjecting all the kids to this particular thing? And you can always copy these slides. I can always give it for every one of you. So the thing is, what we are there is always a counter view, and there are 2 narratives. And my other medicine, general medicine doctors, they felt, no, this is only long COVID. It is not COVID vaccine reaction. I would like to show 2 cases here. This is what this case is a 31-year-old male, and he presented with diplopia. And he presented this in March. Went for a general evaluation to his surprise. Her wife is a doctor, and they had the MRI venogram was done, and venogram, I just read it for you. The picture is a history of dural sinus thrombosis. What you see, you normally post-pregnancy. I have never seen dural sinus thrombosis. As a radiologist, I used to write reports and all that. MRI, we used to do that. It is a very characteristic thing. You need to. You cannot miss the diagnosis. So, but that was an exam question for us. So this was a typical, and apart from that, he had a temporal hemorrhage also. There was a confusion. This thing led the lab reports 20 April. It was D-dimer was 1163, and we did the follow-up in August after doing 4 months of treatment. And MRI venography was again repeated. This D-dimer was 1163 during that particular phase. and he never had any problems with platelets. This is a lucky guy. He had only complaint of headache as well as diplopia. And he resolved very smoothly. He was not having any much. He's a very cool guy. And D-dimer came down to this one. And what happened was this report later on, there was a gliosis of 20th August. We did this study again, MRI, and it showed there was a minimal residual small calendar, irregular superior sagittal and right transverse post-thrombotic sequelae. And patient is doing absolutely well. He probably will be going to US next month or something. So this is another case. This was the case that 31-year-old guy had taken Covishield in the month of January. Okay, I mean from March he started getting problems, right? So this was the kind of scenario. And this 18-year-old girl, Ritika, and I can always get it because the parents told you can always share these reports with everyone. They were very keen on that. So this girl has on 29th May she takes a vaccine which is Covishield, and later second day she had some symptomatic fever and all that and everything. 5 days nothing happened. On the 6th day, she got on this was June 5th. She got a terrible headache and she was having, she had vomitings and all that, suggestive high raised temperatures and all that. They called up and he said, okay, we'll wait for the CT scan of MRI. Next day CT scan MRI, they took it for MRI. She was so restless, MRI, she couldn't wait for 30 minutes. So all artifacts came to it. So then CT scan was done, but patient was horrible. She started having pain in the fingers. She had something like clot also there on the eyelid, and she had such a pain, and she says she's very hyper, that all the fingers and all that were burning, something like that. But we felt okay, there will be some kind of thing, and we checked the platelets. Platelets were low, 40,000 units were there, and we said, okay, after some time, let's wait for a day and see next day what happens. To our surprise, on the same day, platelets 40,000 platelets. She got massive something headache, taken to hospitalization, immediately hospitalized that, and after big surgery, there was a team of neurophysicians, everyone started looking into that. We said we are not able to deal with that alone, we have to take the kind of stuff. And everything was done. There was a surgery which was done, disciplinary hematoma which was there in the frontal area, which was evacuated, and everything. After some time, there was a rumor, after surgery she was okay for a day or two, then again 3 days later she got into problems. It was a very, this happened in June 2021, and she died. And after the death, these parents, they said we want to pledge the organ donation. All the time I tell you, my friends who are going in the hospital, they strictly maintain, no, this is not vaccine induced. This is because of something like a hemorrhage, because of viral fever and all that. It is not because of that. But I can tell you what after that, the ethical committee, because of organ donation, you need to do a complete postmortem. And they picked up, it was VITT, vaccine-induced thrombocytopenic thrombosis. It is a small thing, but thrombosis. This case went to higher level, in the sense we were able to show it to a Chief Justice of India also. He knew about this case. Dr. Alok, we discussed about this case. We called up her mother also into this particular stuff. So this was not a simple case. We thought, okay, this is something like thrombo. Low platelets, I thought of calling to private, he do some kind of Kana or something like that. He tells that, okay, this platelets can increase. Nothing. Suddenly it goes into sinus thrombosis. And this 31-year-old patient, when he comes with the sinus thrombosis this year, I was really shocked. In the sense, he had few features of diplopia and all that, and we were absolutely kind of stuff. Because what happens is that dealing directly is a difficult stuff. So I just want to make the thing open. This were the two cases. This Ritika died 10 days, it took 10 days after vaccine, she was no more. And the other chap is 31-year-old, and he was diagnosed. And so my thing is
Dr.
coming
Praveen,
to
15 more minutes.
yeah, I'll finish up. So the thing is, we have to start dealing with these vaccine reactions. How we can do it? We need to start looking at that. We have already, we always normally, see, as a radiologist, I used to do something like urographic to do IUDs, and I used to check out some people getting anaphylaxis, and we immediately used to do some things. We start giving Echolin, we used to give all Evil and all that. We used to stabilize them. So how we are going to stabilize a patient like this who doesn't tell anything? They may just have something in the purpura. So that is a big thing. And I tell you, all of us who are doing integrative medicine here, we have a chance of doing some brilliant work here. What I did for that 31-year-old is nothing. I just started using, I said, okay, let me start working on that. We did hyperbaric oxygen, we started doing some high-dose vitamin C, we started using all the things, whatever, melatonin, you name it, whatever we have discussed, everything else. Sabji mein pura, khutmi, pudina, sab kuch dalo. Right? So that is the way I think, and somehow...
And how much vitamin C, Dr. Praveen?
High-dose vitamin C, it helped.
But how much? 20,
I think I have
25,
not gone
30?
more than 25 for this guy.
Okay, and what frequency?
We were having a problem because he had a temporal, he had a hemorrhage, and then we had to bring it slightly.
And what frequency, Dr. Praveen?
I had initially normal, I had done for 7 days straight, about second case, 31-year-old man. That guy we had done vaccine IVL for 3 months time. I must have seen him for more than 16 or 15 sessions, something like that. Yeah.
Only vitamin C, nothing else.
I did combine with hyperbaric oxygen. I did combine with all my enzymes, proteolytic enzymes. I tried giving all the things what I learned here. So what I just want to put across is this is a problem with all because we in both these cases we are seeing a direct correlation with the vaccine and this particular thing. And I think the picture बाकी है सर अभी picture बाकी है दो लिए है ना उसको picture अभी बाकी है. I'm not trying to scare you, but I was discussing with Dr. Prabhu. He said I had this problem. Then I said, okay, immediately you start with this ivermectin because ivermectin is one thing. It is going to block this spike protein getting entry with the ACE receptors. ACE receptors in the myocardium or all that. Spike protein gets into ACE receptors, which causes myocarditis. Right? We have to talk about that. We cannot just go away. We cannot just tell that, okay, Piliprastomar died with a high intestinal workout. This is rubbish. There are so many things which are happening. A single kid called KK, he died, and everything says he's because high stress. It's all rubbish.
No stress.
I could see really. I did use ozone also in our case. Yeah. First case, that Ritika, we couldn't do anything because it just went like a firecracker. By the time they were outpatient, they used to consult, and by the time she was admitted, gone. I'll just show you. So this basically when we talked about when we started with Hasnain and Peter Mandesha, we started talking about microclots with curdle and uncurdle. So microclots are there. You have at every level, capillary. You have at a large vessels. You need to just pick up things actually. And I think we as doctors we have a big challenge. And you need to, there is a case who has been taken vaccine. You need to follow every month. You should do a diet. I am going to show you an interesting kind of other stuff. I have just trying to hurry up this particular stuff. That's what I am telling. I couldn't do last year. I couldn't do because the patient didn't come to me directly. On the phone, I tried, okay, you do platelets and all that. I have something like light blood microscopy. We do dark field microscopy, and I'll just show you the pictures and all that. Look at short. Lenny doesn't give me time always.
Yeah.
Another 10 minutes. Okay. So I have to just rush actually. And this is what spike proteins are, the things which are the villains now. It is, and you need to work, literally we need to work on this particular stuff. This is what I'm talking briefly. This circulating spike protein simply bind to ACE2 receptor without entering the cell and inducing a autoimmune response to the spike protein antibody. So we do definitely see all functional medicine doctors are going to practice is going to improve. Samir, you are also going to be, you have done wonderful work during COVID year. So what is the other thing clinically which we can pick up? It is very, very difficult. The thing is this particular thing called rodeo formation. I'll just give you a picture and then you can understand. This is the one of the patient where RBCs they get stacked up, right? This gets stacked up. By God, I think I will do it. I also do that. So this is the easiest thing. You have to just pick up a needle, put a drop of blood, and see under the microscope. And you don't have to wait for the lab results and all that immediately. If you have such kind of thing, put him on a vitamin C, put him on ozone saline or whatever. This is the normal picture. The normal picture. All the cells are scattered. We have no rush here. So this is the second. Second. And then I'll just finish. The other patient who received vaccination 15 years earlier without any side effect noted, but this particular case, when he came to us, he had a severe pneumonia. You see the kind of all cells are getting stacked as a kind of this. You probably you should see that live and microscopy. Sometimes it is slightly tricky, but you can always spend 2 or 3 minutes. You'll get that. So the moment I saw this picture, I said, "Oh, there is a problem." We started giving high dose vitamin C, 25 and all that, and we did wait for D-dimer also. He improved. So this is basically the kind of thing what I just want to take you through. This is and integrative options are already everyone is talking about that. We want to do all that stuff, but I can always tell you there are some things which really helpful. Lenny knows about Dr. Digambar Naik's case. Why don't you tell about him? Digambar is going to come tomorrow. So the thing is, vitamin C has been a big way.
Ivermectin for how long, Dr. Praveen?
Unless there is a kind of thing, at least for a week I give it. For a week.
And what dose do you?
12 grams. 12 milligrams.
Week to 10 days for you to get the effect that he's talking with that.
Perfect. And there are some.
No. Ivermectin is not a standalone thing. You have to add everything.
Yeah.
Dhania, pudina, soap, dila.
Yeah, but second thing, Dr. Praveen, what I'm seeing is this time people who have had COVID, they are having low-grade fever for a long time.
The problem now, what is happening is everyone who is vaccinated is having low fever. According to my mentor, who is Dr. David Lingard, he says this vaccine has, he asked for Rankis test. And surprisingly, there's a retrovirus is added along with that. Everyone has got a retrovirus now who are vaccinated. It will not sound good for people who are taken it. So this is what I just wanted to tell about this because this is a big thing. The problematic thing is the cationic lipid which is toxic. Because what happens is that this particular spike protein is going into the cationic lipid and it behaves as LDL. Your body doesn't know which is LDL and which is this particular stuff, and it moves throughout in the body freely. And I will be definitely interested in questions and all that. I still have 3 months time. 22 minutes are over. 30 minutes is a big time. I'll just check it out. I can always take up questions otherwise. But we are seeing Parkinsonism. I have a friend with 40 years. He said, I'm having tremors and all that. Vaccine, so the thing is, we have to start putting a hat, trying to look into that, whether this is, Vijay Mohan may not agree with me, but I think this belly bodies and all that, I can always show you this is the way things happens. And I'm talking from, I'm taking this journals also. This is not something like we had, this is an issue we are facing now. And yes, this is anosmia. You just think anosmia is just a loss of smell. It's not like that. It has got bigger ramifications. And from there it goes directly to, you may 1 or 2 years later, you may get into something like tremors and all that. Vipul bhai, your Ayurvedic Kara is taiyar karo aap uske liye. So
And in young people, anosmia is staying for a long time.
but those are the people who are going to get into neurodegeneration is our take. You have to be careful about that. You can always tell them, okay, we follow some of the things which are practiced here so that we don't fall into that. That's the thing you can do. So it's a slightly scary picture, but I thought as doctors we need to know about that. When Lenny called me, you need to give a talk, I said, okay, I'm going to give a talk on this. I was giving a talk in World Federation of this one, and somehow I'm not anti-vaccinist, but I want safe vaccines. And this vaccine is not safe. It doesn't change your T cell. It's only the B cell or auto antibodies are going to increase. And this is the perfect storm. You can always look into the papers and all that, right? Look into this particular stuff. And this is what I know a lot of people who got into problems. I have all my patients, they know one in the family or who got a sudden heart attack. We have a friend who is a very good friend of ours, homeopath doctor, suddenly died of a heart attack. And we were not able to understand. And the thing is, look into this particular stuff, how this spike protein can cause cardiac issues. What is happening is, this spike protein causes stress and binds to ACE2 receptors, and this causes accumulation of angiotensin 2, which activates. So the saying is, from microphage, this particular thing, the cardiac fibroblasts, they get blasted. Blasted in the sense, it's not cardiomyocyte which gets ruptured. And it is a very tricky thing for any big cardiologist with a great setup also, he cannot save this patient. So the thing is, we have to be careful, and yes, we have to tell that you need something like keep on doing some tests and all that, trying to work on how you pick up something like at least there's something like CBP every month. If you see lymphocytes which are going above high, and you can, or it is going low, lymphocytes going high is in autoantibodies. Low also is a big issue. And if you just know that, okay, you can follow up that particular person and look into what is happening to platelets and all that. Because he will not tell you, brush karne ke baad bleeding hua, he will not tell you that.
Exactly.
You have to be careful. So this is my talk. This was all the peer-reviewed studies we have tried to pick up, and we have to take all these things with a pinch of salt. And har ghadi badal rahi hai. I believe. I don't know how things are going to happen, but this is a reality. All of the doctors, including all pathis, we started working with all things. People knows better. We feel that everyone who deals with the patient is an important guy, and everyone are accountable. Why should we take accountable for somebody who makes a nasty thing? And we are just a kind of, we are not something like dalal. I don't want to make that word, but I felt why the doctors are so sketchy about that. All of the hospital, when this 18-year-old girl died, everyone said, no, it cannot be vaccinated.
Yeah.
How can they be so confident about that? That is the kind of...
They've been primed like that, Dr. Praveen.
I'd like to share my experience.
Please.
And I know time is short. So
When you are waking up in US, I want you also to wake up. That's the kind of thing. Yes.
The Zoom call that I think you saw was, I think I'm the first doctor probably in Asia who asked ivermectin to be used for COVID. And then I did 4 subsequent Zoom calls. In that interim period, I've treated 840 patients post-COVID.
I'm in touch with Saxena Shetty also.
Yeah.
We are trying to put up a world panel, and maybe because this is a different. This is a separate.
I've appeared on one of those shows. I have done 840 patients. post-COVID vaccination, none have died. There is definitely, it's a bioweapon, there's definitely poisoning. There are about 20 different kinds of heavy metals, and which we have documented on doing heavy metal toxicology. There are massive amounts of aluminium which will cause clotting. That's the one thing aluminium does, other than renal failure. Singapore is having an explosion of renal failure. You will go through myocardial, this one. If you look at the side effects of vaccines, number one is central nervous system. We've got people going blind, people going deaf. Right? But just remember this, if they come like that and they say go severe vertigo and all, they're clotting in the brain.
Even doses. People have started getting doses in the brain.
So I do 4 tests, or 5. D-dimer is 1 because I'm an anesthetist. Serum fibrinogen, so you will know if you see the serum fibrinogen going up and it's more than 7, you're clotting. You're definitely clotting. D-dimer is far better than doing TROP-T, ECGs and all, because ECG doesn't give you anything until you get a heart attack. Okay, and that will be a few hours later only you see ST segment depression elevation. TROP-T becomes positive only 6 hours after heart attack. Please don't look at that. Okay, X-rays will not show you lung embolisms. I've had 2 doctors.
Sir, we have done some cases, cardiomyopathy, and this BNP was quite over the roof, you know. I don't know what is happening with it.
Yeah, so they have viral myocarditis, okay? So I do D-dimer, serum fibrinogen, HSCRP, ESR goes up when you've got problems, and platelet count, okay? To block the spike proteins, very simple. You can use zinc, you can use ivermectin, colchicine, hydroxychloroquine. Okay, the doses you can talk to me personally afterwards, I will tell you. My mainstay, first thing I do is I give zinc picolinate, 150, 200, you can give whatever zinc picolinate, you don't get stomach problems. Okay. We give vitamin D3, we give quercetin, because we patch the damage done by DNA. Vitamin D3 balances your DH1
we can see what Lenny has done for Digambar. Lenny, it's a time. Come on. We are not looking good there, sitting there. Come to the stage. I want Lenny to talk here because he has done something phenomenal for Digambar man.
Yeah, if you can't give IV, give oral. Yeah, give 2,000 milligrams every 4 hours. So it's up to about 8,000, 10,000 milligrams. Yeah.
Okay, so till the oral components are this, you can always keep on giving everything.
Saxena, while we're talking about vaccine-induced injuries, I have not seen you speak about one thing that I am seeing every day in my clinic. Every day. The problem is serum ferritin.
Yeah.
Yes.
Everyone, and this is no symptoms. They come to us for normal things like, I'm not looking too good and things like that. Very early.
I want Dr. Dravid also to share his experience on.
Yeah, so I'm opening the floor after the last session. So just give me 2 minutes. I just wanted to say this. Nobody has addressed this. I want somebody to address this, but I have one speaker to finish after you. After that, I'll open the floor. Is that okay?
So, thanks for giving me time.
Thank you, Dr. Praveen. And this was very, very interesting. We look forward to speaking to you more on this after.
Thank you.
Thank you. And Dr. Praveen, thanks for all the great work you are doing in this, especially creating so much awareness among people. So, for those who don't know, Dr. Praveen is very, very actively working on this since a long time, and he's invested a lot of time, resource, and everything. And I think he keeps himself updated, and we get updated just through him, right? So it is very easy for us. But thank you, Dr. Praveen, for being active in this space.
Madam President, just for the knowledge of everyone here, there are quite a number of new faces. This journey of ISSMTCT started in 2004. Dr. Hussain Patel was one, Dr. Praveen Saxena was second, and I was the third. It was 3 of us who sat down and we started this whole movement. He's been here, coming year after year. I'd like you to give a big hand for
Great. So our next speaker is Mr. Raghav Priyadarshi. He's the founder and CEO of Savikalpa Sciences, a cannabinoid medicine-focused phytopharmaceutical firm. With a mission to promote integrative approaches to health and healing, Savikalpa is bringing to market novel therapeutics that combine the best of the traditional medicine approaches with the rigor of modern pharmaceutical R&D. Raghav is also the co-founder of Cohen Advisory Group, India's leading public policy research and advocacy firm, headquartered in New Delhi. With extensive in-house legal and economic expertise, Raghav blends his understanding of regulatory and policy arenas with the technical prowess of India's life sciences industry to position Savikalpa Sciences in India as the global leader of functional and integrative healthcare. Please give a big hand to Raghav. Thank you. Welcome, Raghav.
Pleasure to be here. I'm speaking at the fag end of the day. It's a nice breeze outside, and I'm sure everybody's looking forward to some cocktails and things like that. So I'll try and keep my talk breezy also, because I'm sure there's lots of questions after the last talk I want to get up. I'd like to start by thanking Dr. Sachdeva, Dr. Chopra, who encouraged me to participate, and Dr. Lenny and his team for providing me the opportunity to be here. I also recognize that I'm perhaps the least qualified individual in the room, and therefore I need not delve on various aspects of cannabinoids, cannabinoid medicine. I've decided therefore to keep the talk relatively tight and light so that we can proceed with the rest of the talk. So cannabis and Ayurveda. I would like to start with this slide because I would like to present the fact that we're not looking at anything that is new. Cannabis is a therapeutic ingredient that has been part of pathies for many millennia, effectively, including in India's traditional medicine ecosystem. Bhang is something that we're all familiar with. It has been part of traditional pharmacopoeia in the country. But why Ayurveda does recognize the therapeutic benefits, I've inserted this one photograph here to point out the fact that just like most of the persons in this room have nothing to do with the Panditji or the Vaid who's preparing the medicine or his Bhang preparation, similarly our formulations have little to do with traditional classical form factors as recognized in Ayurveda. We take inspiration from our old ecosystem, but we wish to apply the prism of modern drug development to bring formulations that can be administered to patients who are cannabis naive, not just in India but across the world. I would like to point out that cannabis has been described as an upavisha, a minor poison, and even in the classical Ayurvedic texts, there is a certain process, a shuddhikaran that is prescribed so as to ensure that the efficacy is maintained while limiting what some of the negative or some of the side effects presented by cannabis are. There are in the classical grunts over 200 formulations that we have identified which have cannabis as a principal therapeutic ingredient, and that gives us a lot of inspiration for conducting significant R&D using the life sciences expertise that we have in the country. Just a small slide to show the various descriptors of cannabis found in Ayurveda in particular, and they're rather evocative and suggest what the multi-potentiality of this particular simple yet powerful herb is. So the most common terminology used to describe cannabis is Vijaya. Even under Ayush, even under the current regulations, Vijaya is the name given to cannabis or cannabis formulation in particular. Shiva, Muli, Divya, and what I've tried to do with the brackets, as you can all see, is to give some approximation of what that would mean in a current English context. Speaking of the pharmacological actions that one is able to derive from, again, the classical texts in particular, one sees that there is a multiplicity of activity that cannabis presents. I've tried to present it in a synthesized format here, but most interestingly, there seems to be activity across various parts of the human body. So when it comes to the GI system, the reproductive system, the CNS, the metabolic activity, as well as some of the specific actions that I mentioned in the classical text of the formulations. What is very interesting is what, again, the descriptors for these particular formulations are. So, for example, when it comes to gastrointestinal activity, Grelli, so absorbent. This points to potential action when it comes to things like leaky gut syndrome, when it comes to IBS, when it comes to GI inflammatory conditions such as Crohn's. Deepana, which is, for example, an appetizer. We know today that THC in particular activates ghrelin, and and that leads to an increase in appetite, which can have very significant applications when it comes to inducing appetite in patients suffering from cachexia, who might be on medications which suppress their appetite. And while it may not necessarily be therapeutic, but for patients or even families, let's say they have an individual, an elderly person who's not, being able to consume food, consuming cannabis and enabling appetite stimulation, even small things of that nature can be quite significant when it comes to the quality of life of patients. Other things which are very, very interesting to note are, for example, Nidrajana induces sleep. We know today that cannabis has very, very significant applications on neurological conditions, in particular insomnia. Also, migraine, I would like to add here, is another thing in which we're seeing that very, very significant activity, very significant benefit of cannabinoid formulations. That said, there are certain things to look out for, and it's interesting that even the classical texts recognize that. For example, murcha, syncope, we do find that in a small subset of patients, there can be syncope. Hypotension is one of the things which is one of the side effects associated with cannabis, along with tachycardia. I would say these are the two most prevalent transient side effects when it comes to consuming cannabis medicine. In a more modern context, if I may say, moving on from the classical context, effectively, cannabis seems to be quite prevalent in the pharmacopoeia of the late 19th, early 20th century. But for various reasons, I don't think it's relevant at this point in time to go into those as to why it went out of favor. But largely, since 1937, when it was restricted in the US, and more particularly since 1961, when all the UN member states signed on to the UN Convention, the Single Drugs Convention, in which cannabis was registered as a Schedule 4 substance, therefore having no therapeutic value whatsoever. I think that it is the past 50, 70 years that has seen a reduction in the